Okay. All right. Hi. Welcome to HSTA's Facebook Live. My name is Khalib Wohal. I'm with the EUTF with our outreach and training. And today we'll be going over some very important information about this year's annual open enrollment. So I'll go ahead and start our presentation. I think I hit the wrong button. Bear with me, folks. Okay, so here we go. This year's annual open enrollment presentation is available on our website at eutf.hawaii.gov. But then today, what we're going to do here is go over the presentation here via the HSTA's Facebook Live. And so let's just go ahead and get started. Okay, so our presentation will consist of the following information for open enrollment. We will go over open enrollment, important dates, and form submission deadlines. There have been some changes I'd like to go over with you folks today regarding open enrollment. And also keep in mind, open enrollment is your opportunity to make any changes to your health insurance as state and county employees. But remember, if you don't want to make any changes, there's no action needed on your part. So either way, we thank you folks for coming and for listening to our presentation today. Our next topic we're going to go over is online resources, particularly our website. With everything that's going on with COVID-19, our website has become our focal point for information and updates. So we're going to touch a little bit on that. We'll also be going over some plan changes for 2020. This plan year, there hasn't been a whole lot of changes, but we'll touch on those. Health plan selection. This is just good information on how you can select a health plan that'll best meet your needs. We'll also talk about enrollment. So for those of you who do want to make a change or changes to your health insurance for this coming open enrollment, here's how to fill out the form, other documents that need to be submitted. We'll touch on that. And then finally, some important information on saving money saving tips, as well as our wellness programs. So let's get started with open enrollment. Okay. And also, if at any time during this presentation you have any comments or questions, please feel free to utilize the chat feature available to you. Okay, so let's go ahead and get started. Some important dates for this year's annual open enrollment. Our election period has been extended from April 1st all the way to May 15th, 2020. So employees who wish to enroll or make any changes must complete and submit an EC1 or EC1H enrollment form and any required proof documents to either your human resource officer, county personnel officers, for bargaining unit 5 employees, for you teachers out there, it'd be the DOE EBU office on or before the submission deadline of May 15, 2020. And as I mentioned, for employees who do not want to make any changes, no action is needed on your part. What you currently have now will automatically roll over into the next plan year come July. Our processing period, this is the period where EUTF will receive the forms, and enrollment forms received on or before the deadline will be processed during the months of May and June, right? Ending part of May and the month of June. Once the enrollments are processed, if you are making changes and we process your enrollment form, we will send you a confirmation notice mailed out to each of the employees making changes. If you do not receive a confirmation notice by the ending of June, please contact our office at the EUTF. For employees not enrolling or making any changes during the election period, there will be you folks will not receive a confirmation notice. Okay. New plan year for active employees begins July 1st and continues to June 30th the following year. All changes made during open enrollment will take effect July 1st, as well as any health plan changes, including premium and rate changes. Okay, our information regarding the new premiums that are set to change come July 1 is available on our website, EUTF etf.hawaii.gov under the Active Employee tab on the home page. Okay, new premium deductions from paychecks. So for state employees, you'll see the changes to your premiums come July 20th, 2020, and they'll continue all the way to July 5th the following year. For county employees, their pay schedule is slightly different. They will see the changes come July 15th, 2020, going into June 30th the following year. Online resources. So as I mentioned, this will be your area to get your information from the EUTF regarding open enrollment and any other changes to our procedures as far as eligibility and enrollment. So on our website, again, the address is eutf.hawaii.gov. You want to go into the active tab. So there's that blue menu bar across the top there. You definitely want to hit the active tab there. And through the active tab, you can access things like our EUTF active employee reference guide. So this guide is written annually every year. So the new guides out there uploaded as a PDF. Also, you can get form fillable PDF versions of our enrollment form. So you can complete the entire form online. You will have to print it out, however, and send it into your respective personnel office, or in your case, it would be the EBU office for both the EC1 as well as the EC1H form, also available on our active employee tab. We also have an open enrollment checklist. So this list is good to just make sure that you've completed the correct form, are supplying us with the correct proof documents. If you're making any additions, you're adding dependents. And it also has a list of all the relevant deadlines for open enrollment on this checklist rather. I also want to go over a few website tools that you can use during open enrollment. The first would be our EUTF premium plan comparison. Premium plan comparison. So what this tool is designed to do, again, it's in our active tab. By following the prompts, it'll show you what your current premium, would be if you leave the plans the way they are. And it'll also give you an opportunity to show you what your premiums could be if you switch to a different plan. So we will give you your current, the premiums of your current plan come July 1st. If you leave everything the same, or you can compare that with up to 2 other health plans. So if you're currently on the 80/20 HMSA plan, for example, and you're looking at switching to either the Kaiser standard plan or the HMSA 75/25 plan, you can use this premium plan comparison, and you'll be able to see an estimate on the impact, at least financially, as it affects your monthly premiums, how much your premiums would go up or down depending on any changes that you make. Okay, so it's a great tool that employees use during open enrollment to kind of give them an idea of what kind of impact changing their plans would have. Another tool that we have available to you folks is our EUTF Plan Finder. So we get a lot of calls into the EUTF because folks may have the HMSA plan, they just don't know which one. You know, there's 4 different HMSA plans you can select as a EUTF member. There's 2 different Kaiser plans. So this tool allows you, using the information off your pay stub, to tell you which plan you currently have now. Not just your medical, but also if you have dental, vision, and whether it's a single, 2-party, or family. So there's a lot of information available. Short of contacting our office or contacting the carriers directly, you can use this Plan Finder tool. Okay. We also revamped our Learning Center. So the Learning Center will provide members a wealth of information regarding health-related topics. If you're thinking of retiring, our active employee tab has information on open enrollment. And if you have a qualifying event would be something like if you get married and you need to add your spouse, or if you give birth and you have a child and you want information on how to add baby onto the plan. All this information is available in our Learning Center, not just in PDF documents, but also as video tutorials. It's also available there as well. So it's great information, great resource for you folks for health insurance, health plan, EUTF related topics. Okay, at this time, I want to go over some plan changes. There's actually not a whole lot of changes happening for this coming plan year. So effective July 1st, unless otherwise noted, if you're an HMSA member, for both the EUTF as well as HSTA VB active plans, added coverage of 3D digital breast tomosynthesis screening under the mammography screening benefit, as well as air ambulance coverage from Hawaii to the continental United States. So that's an addition. For critical care treatment when commercial travel is not an option because of the need of life support equipment or other medical support team. Kaiser, we have a few changes also. Added 40% hearing aid coverage, so your responsibility would be the 60% as far as co-insurance goes, for one hearing aid per ear every 36 months for EUTF active plans. Pre-exposure prophylactics, or PrEP, for the prevention of HIV infection. Medication is also covered at a zero copayment for EUTF and HSTA VB active plans in accordance with federal law. So if you're under the HMSA medical plan, you probably have CVS, or you will have CVS Caremark as your prescription drug carrier. So here's some changes with CVS. Similar to the Kaiser change, pre-exposure prophylactics, PrEP, for the prevention of HIV infection medications covered at zero copayment for EUTF and HSTA VB active plans, as well as the change to the maximum out of pocket to the HMSA 7525 PPO drug plan. So if you have this HMSA 7525 PPO plan, your maximum out of pocket will increase from $2,900 for single, $5,800 for family, to $3,150 for an individual, $6,300. That takes effect January of next year, 2021. Okay, a couple more changes. So for dental, we had an addition of coverage of 2 additional teeth for silver diamide fluoride, or SDF, per data service, and coverage for restoration if placed after 30 days of silver diamide fluoride treatment. For EUTF and HSTA VB, it's 100% coverage. If you're under the HSTA VB supplemental dental, it's 50% coverage. Silver diamide fluoride is a new type of treatment for cavities that's being offered. And also added coverage for athletic support mouth guards for members age 18 and under every 24 months for EUTF and HSTA VB, 80% coverage, and the HSTA VB supplemental dental plan, 45% coverage. Okay, so we will pay for mouth guards for your dependents to protect their teeth while they're doing their sports activities. For VSP, both EUTF and HSTA VB active plans, there's an increase in retail frame allowance. Yay! I'm going to get frames this year. From $120 to $150. Remember, frames are covered every other plan year. Okay, so if you got frames last year, you got to wait till next year. I didn't get frames last year, so I'm good for this year. So also increase the contact lens allowance from $120 to $130 for your contacts. Contact coverage every year in lieu of glasses. Okay, so with our vision plan, it's either or. You're either getting a set of glasses or you're getting contacts. So it's normally the benefit doesn't apply to both in any given year. Okay, and then the last one we have is premium and contribution amounts for 2020 and 2021 plan available. Also for 2021, these premiums can be found, again, you can check our website, or it's available in our EUTF active employee reference guide on pages 16 and 17. That's also available on our website in a PDF, or is actually printed right on the enrollment form. So if you are making changes for open enrollment, make sure you get the correct form. So the open enrollment form you want is the form that's dated for 2020, 2021. Okay, that one has the current rates that are going to affect come July 1. All right, any other qualifying event that happens prior to July 1st, you want to use the other form, the 2019, 2020. But for open enrollment purposes, use the correct 2020 EC1 or EC1H form. Okay, make sure you got the right info. Okay, next we're going to go into health plan selection. So health plan selection is that section of our presentation where we try and give you folks information. Health insurance can be kind of complicated. So hopefully some of this information that we like you to consider will help in selecting a health plan that'll best work for you and meet your specific needs. First thing, of course, you want to consider when selecting a health plan is the premiums. How much is this plan gonna cost every month? So the monthly premiums are the monthly amount paid for your health insurance shared between both the employer and the employee. Okay, so in most cases, as state and county employees, we don't pay the whole premium, but it's divvied up. It's somewhere near a 60-40 split, with the employee paying about 40% or so, and the employer covering about 60%. The amounts vary depending on which plan you get, but check the premiums. Some of you may have a plan that you're happy with the premiums. Some of you, your premiums might be slightly high. You may want to think about, you want to weigh the two options, whether you want to plan, maybe if you're someone that doesn't go to the doctors very much, or you hardly use your plan, maybe you may want to save some money this year and go for a plan that would cost less premium wise. Okay, so there's some things that you may want to think about. All right, deductibles. Okay, deductibles, it's the amount that you pay upfront before the health insurance benefits are made available. So deductibles do not apply to all plans or all services. They cannot be paid in advance and are renewed annually. Okay, deductibles follow a calendar year. Okay, and they're based on a claim by claim basis. So if your plan has for example, the HMSA 7525 plan has a $300 deductible per person on the plan, which means that you have to satisfy the first $300 of covered services. It's not something that you just pay up front. You actually have to have services, like you go to the doctor or some kind of medical service. And like if your doctor visit ran you $100, you have to pay that $100 up front, and $100 gets applied to that $300 deductible. Okay, actually that's a bad example, because not all services apply towards a deductible. So if you have let me use a different one. Like if you have surgery, for example, you have $1,000 surgery. The first $300 comes out of your pocket because it's a deductible, and then the remaining $700 gets applied to the plan benefit. In the case of the 7525 HMSA plan, HMSA will cover 75% of the remaining balance of eligible charges, and you'll be responsible for 25%. Okay, and the reason why I switched the example is because that $300 deductible in the 7525 plan does not apply to office visits. All right, so that's a perfect example. Number one, check if your plan has a deductible. Number two, check if whatever services that you are getting apply towards that deductible, because not all of them do. Okay, and they are met claim by claim. It's not something that you can pay up front. All right, hope I didn't confuse anybody over there. Calendar year versus plan year. Okay, so majority of our services will, pretty much all the medical and prescription drug benefits run on a calendar year, which starts January 1st and ends December 31st. Other benefits, such as dental and vision benefits, run on a plan year. So our plan year begins every July 1st and it goes all the way to June 30th the next year. Okay, so please familiarize yourself with the differences between the two. For example, for your medical, if you're like your deductible renews every January 1st. All right, so if you get services and you say January, the beginning of the year starts, and you go to the doctor several times, and sometime in September you satisfy your $300 deductible, and you keep seeing the doctor, keep having services, and then the following year happens, and then you go to the doctor, and all of a sudden you're stuck with a new $300 deductible. It's because the benefit renewed. Okay, the whole thing, the deductible goes back, zeroes out back to zero every January 1st. Okay, because it's based on a plan year. Okay, same with the dental and vision. If you need a new pair of glasses, okay, you're not waiting for January 1st to get that new pair. You're waiting for July, because it's based on a plan year, which for us, plan year starts July 1. Okay, just some things that you need to be aware of as far as when benefits renew. Some of it's based on a calendar year, some based on a plan year. In network versus out of network. So You always get a higher level of benefit by seeing in-network providers, in-network doctors, hospitals, pharmacists, in-network dentists or vision providers. You get the higher level of benefit. Some of our plans will allow you benefits if you go out of network, but even the plans that do allow out-of-network benefits and do pay for those benefits, the reimbursement is less versus seeing an in-network doctor. So as a rule of thumb, whenever you use our benefits under HMSA or Kaiser, any of the EUTF plans that we offer our members, just check and see, in order to maximize your benefits, make sure you see in-network providers. Co-insurance and co-payment, this represents the amount that you pay or you're out of pocket. It's either based on a percentage, like the HMSA 80-20 plan. For most services, HMSA covers 80%. Your co-insurance would be the 20% balance of whatever that ends up being, depending on how expensive the service is. Co-payment is your out-of-pocket based on a fixed dollar amount. So when you pick up generic medications, you pay a straight $5 co-payment, would be an example of that. And then the last one would be maximum out-of-pocket. So your maximum out-of-pocket benefit is basically, it's your financial protection. So it's the maximum amount in co-insurances, co-payments, deductibles that you will pay for covered medical and prescription drug costs within a calendar year. So how does that work? Well, maximum out-of-pocket has its own slide here. But as I mentioned, it's your financial protection. All covered co-insurance, co-payments, and deductibles apply towards this maximum out-of-pocket. So how this thing works is when you start receiving services, it's a calendar year benefit. So it starts every January 1st. As you receive services, if you have a surgery, go to the hospital, see the doctor, you pay your co-insurance, your co-payment, and then the health insurance, either HMSA, Kaiser, what have you, they pay their half of the benefits. Well, the health insurance keeps track of all your out-of-pocket, the amount that you're paying. And if that amount ever hits the set maximum out-of-pocket benefit, once you've reached that maximum out-of-pocket benefit under your plan, whatever it is, then from every co-insurance or co-payment that you pay thereafter, it's actually going to be covered by the health insurance at 100%, okay, for the remainder of the calendar year. So for example, if you're in the HMSA 80-20 plan and you have $1 million hospital bill of covered services, you're not going to pay 20% of $1 million. Your out-of-pocket stops at whatever the maximum out-of-pocket benefit is. So for the 80-20 plan for HMSA, it's $2,500 per individual, or if 2 or more people meet that, then it's $5,000. It's $2,500 per individual or $5,000 per family. Okay. Keep in mind, even if you do hit that 100% coverage through the maximum out-of-pocket, you are still responsible for any non-covered services, such as tax, would be an example. And then because it is a calendar year benefit, the whole process resets every January 1st, okay, every calendar year. So these are the amounts, the maximum out-of-pocket amounts for each of our medical plans. The HMSA 90-10 plan, 80-20, 75-25. The HMSA EUTF HMO plan, $1,500 for individual, $3,000 per family for the medical. And you notice below there's also a maximum out-of-pocket amount for the prescription drugs. And then we even have, for you Kaiser members, we have the Kaiser Comprehensive and the Kaiser Standard maximum out-of-pocket amounts. So like as I was saying, the HMSA 80-20 plan, the maximum out-of-pocket for an individual, so one person on the plan, is $2,500. So if you ever pay that amount out of your pocket and you hit that maximum out-of-pocket benefit, every service that you receive thereafter up until the end of the calendar year will be covered by HMSA at 100% for covered services. If 2 or more people hit that maximum out-of-pocket, or the $5,000 for family, then the entire family, even if you have a family of 12, the entire family hits the maximum out-of-pocket, and then their services are covered up to 100% for the remainder of the calendar year. Then come January 1st, the whole process resets itself. So this benefit's really designed, just that first bullet point there, financial protection, to protect you financially, you and your family, if you folks have or experience a catastrophic injury or illness. Okay, so that was a lot of information I just went over regarding health insurance and health plan selection, but let's see how all this works in practice. So we have 3 examples I want to go over. We'll start off with this first one here with Rick, who's considering enrolling in either, he wants to enroll in one of the HMSA PPO plans, either the 90-10, the 80-20, or the 75-25 plan for the employee only, so self only. Okay, so first thing you want to look at is the annual premiums. How much is this going to cost him? Okay, so what we did was we got the monthly premiums and just times it by 12. So if he goes come July 1, if he goes with the HMSA 90-10 plan for self only, after a 12-month period, his annual premiums will be $4,634 for the year. That's how much is going to come out of his check over a 12-month period. Okay, if he goes with the 80-20 plan, that amount is $2,971. If he goes with the HMSA 75-25 plan, that amount is $767. All right. So those are the differences in just the premiums. Now, Rick anticipates 4 doctor visits during the calendar year. His doctors charge $100 per visit before the insurance pays. So his total estimated annual cost for medical off those 4 visits is $400. And again, this is before the insurance pays, right? So if he goes with the HMSA 90-10 plan, again, 90-10, so HMSA covers 90%, his out-of-pocket is 10% of the remaining balance. He has 10% co-insurance off $400, 10%, that's $40. Add that to the annual premiums, so his total out-of-pocket expenses for the year would end up with premiums plus co-insurance, $4,674. Okay. If you go to 80-20 plan, okay, it's just doubled. His co-insurance is 20% instead of the 10%. So you add co-insurance plus his premiums, $3,051 is his estimated annual expense. If he goes with the HMSA 75-25 plan, all right, 25% co-insurance is $100. There is a $300 annual deductible, but as I mentioned, the annual deductible does not apply to office visits. Okay, so we're not going to even factor that in. So his total estimated annual cost under the 75-25 plan is the annual premiums plus that 25% co-insurance from those 4 visits, or $867. So the lowest costing plan, or the one that's going to save Rick the most money, obviously in this example, is the 75-25 HMSA plan, okay, with 4 doctor visits. Great plan if you don't see the doctor a whole lot. Now, let's try and run this exact same scenario, but with a more expensive medical out-of-pocket. Okay, so Rick is anticipating $19,100 in covered in-network medical expenses with the $300 subject to the 75-25 deductible. Okay, so the deductible is going to come into play this time. All right, in the early part of next year. $19,100. So we're going to go with the HMSA 90-10 plan first. Everything stays the same as far as premiums go, is just for him. So the 10% is $1,910. So he's $90 shy of meeting that $2,000 maximum out of pocket, if you notice that. So his total estimated annual cost is a 10% co-insurance plus the premiums, $6,544. If he goes with the HMSA plan, the co-insurance is 20% of that $19,100. That's $3,820. Now, Rick is not going to pay $3,820 because the maximum out-of-pocket for the 80-20 plan stops his out-of-pocket at $2,500. Okay, so you see how that works. That leftover $1,320 balance is covered at 100% by HMSA. Okay, so that's how this maximum out-of-pocket benefit works. So instead of paying the 20%, Rick is going to just owe the maximum out-of-pocket. So the $2,500 maximum out-of-pocket limit plus the annual premium of $2,971 equals $5,471 for the year. Okay, so that's less than the 90-10 plan. Plus, he's met his maximum out-of-pocket, which means if he goes back to the doctor or has any other services for the remainder of the calendar year, guess what? Rick doesn't pay anything because he's met his maximum out-of-pocket. Okay, let's try the last one. 75-25 plan. All right, so this one is subjected to the $300 annual deductible. So what we're going to do is we're going to take that $300 deductible off the top of the 19,100, okay, which leaves us 18,800. Now we subtract for the 25% co-insurance. We come up with 4,700 out of pocket, plus the $300 out of pocket that you had to pay towards the deductible. That totals $5,000, which happens to be the maximum out of pocket. So for the 75/25 plan, it would be the maximum out of pocket of $5,000 plus the annual premium of $767. Total is $5,761. So the lowest costing plan in this scenario is the 80/20 plan. Okay, 80/20 plan. Right. Now, we have one more scenario for you Kaiser members. Malia is considering enrolling in Kaiser Comprehensive or the standard plan. She's not sure which one. So let's look at the premium. So for the comprehensive for the year, just for herself, $3,225. If she goes with the Kaiser standard plan, it's $810. Now, Malia will undergo surgery and was told the cost before insurance could be as high as $50,000 in an in-network hybrid facility this year. Under the Kaiser Comprehensive, if she selects this plan, with the Kaiser Comprehensive, your big ticket items such as hospitalization and surgery is covered at 100%. So if she goes with the Kaiser Comprehensive, all she will owe is a premiums, in this scenario at least, $3,225. With the Kaiser Standard plan, okay, her surgery and hospitalization, she has a 15% co-insurance, okay, but of course she's not going to pay the 15% of the $50,000 because it exceeds the Kaiser Standard's $2,500 maximum out of pocket. So in this scenario, she just pays a maximum out of pocket of $2,500 plus the $810 annual premium, or $3,310. So the lowest costing plan is the comprehensive in this scenario, but not by much, by $85 between the two. So if you are planning on making any changes this year, you will need to complete an enrollment form. So let's just do a quick walkthrough through our enrollment form. Again, it is available on our website, eutf.hawaii.gov. Please ensure you have the correct form. You want to complete the 2020 EC1 or EC1H form if you are planning on making changes during open enrollment. Okay, so complete all sections except the coverage start date section. That section does not need to be completed because the coverage start date tells us when to start the plans. During open enrollment, all plans begin July 1. That's why you don't need to complete the coverage start date section. Okay, attach any applicable proof docs, and we'll go over what those are in a little bit. Submit your forms on or before the May 15, 2020 deadline. For you bargaining unit 5 employees, for the teachers, it'll be the DOE EBU office. Now, the address and the contact information of the DOE EBU office is in the top upper right-hand corner of our EC1 or EC1H forms. Okay, that's where you submit the forms to. Okay, so let's go ahead and go over the form. Under the first section of the employee data, all of these fields here needs to be completed. As I mentioned, cover start date, leave that blank because it's for open enrollment. And then under plan selection and contribution, employees must check the box of each plan they wish to enroll in. They may enroll in only one medical and prescription drug plan. Okay, just one. All right. Spousal partners and or dependent child may enroll in the same plans as the employee, but may not enroll in health plans on their own. Okay, so as an employee, if you're in the HMSA 80/20 plan, your spouse, your partner, and your dependents must also follow. They cannot be enrolled under a different plan. All right, everyone follows the employee. Life insurance is 100% employer paid and is available for the employee only. If you want the life insurance, you just check the box on the form near the bottom of section 3 under the plan selection to elect life insurance. Again, available to the employee at no cost. You flip the form over, and under dependent information, this is what you need to complete in order to add a dependent, spouse, partner, or dependent children. Okay, if dependents are being enrolled in EUTF plans for the first time, please submit the following proof documents. So if we have if you never enrolled your spouse or your partner, maybe you just got married, or you have children that you never enrolled in our plans before, you do need to submit proof documents, and here they are. So just for the employee, there's no proof documents needed. If you're adding a spouse or partner, we need the marriage certificate, okay? If you've never sent it to us before, we need the marriage certificate. For domestic partnership, we need those documents, as well as for civil union, the certificate. Domestic partnership documents are available at our website to complete, should you need to do so for domestic partnership. Okay. Adding the dependent, we need a birth certificate. We also need the guardian decree if you're a legal guardian, adoption decree if your child is placed for adoption or is adopted. Okay. And for dependent children aged 19 to 23 who are full-time students enrolling in dental and vision plans, okay, we do need a student certification letter, basically a letter from your school, their school or college, showing that they are full-time students. Okay. Under the other insurance information section, employees must complete this section if they or any of their dependents are covered under a non-EUTF health plan. Say your spouse has HMSA through their work, or maybe the employee is retired federal and has health insurance under the federal government, military, TRICARE, we would like that information. If it doesn't apply, leave it blank, please. And then the last section, employee signature, please read the statement, and if you agree, sign and date the form. Okay. Form submission. Enrollment forms must be submitted to Human Resource Office, Personnel Office, or for Bargaining Unit 5 employees. For you teachers out there, it'd be the DOE EBU office by May 15, 2020. Okay, all proof documents must also be received in order for us to process any kind of enrollment changes. Okay. Now, once we get your enrollment form and any proof documents as it applies into the EUTF office from your employer, we will start the process of making changes. Okay. Once the changes are made on the EUTF side, our systems will automatically trigger a confirmation notice. You will get this letter in the mail showing you the changes that EUTF has made towards your health insurance, whether you made plan changes or you added dependents or you removed dependents, whatever the changes that you made under that EC1 or EC1H form that you submitted to our office, those changes will be once implemented in our system, it'll trigger this confirmation notice to be sent. Now, if everything's good to go, when you look over the confirmation notice, please keep this for your records. If there are any errors, maybe we signed you up under the wrong plan, or we misspelled your spouse's name, something like that, please utilize the corrective action form supplied with the confirmation notice. All changes need to be done in writing. Okay, and then go ahead and submit it into our office. And again, keep in mind, if you are not making any changes, if you don't send an EC1 form over to us, you won't get a confirmation notice in the mail. This notice is only for folks that decide to make changes during open enrollment. Okay. Okay, let's just wrap up our final topic here, money saving tips and wellness programs. So the question happens to be told to us very often, you know, what are some ways we can save money? Healthcare costs tend to be rather expensive and they tend to rise. First thing you can do to help save some costs is choosing a plan that's right for you. Some of the information I went over doing the health plan selection, you want to look at your cost share, the amount that you pay versus how much you pay in monthly premiums. And you also want to be aware of your maximum out of pocket. You know, how much out of pocket expenses do you need to pay before you get that 100% coverage? Okay, that's something that you should be aware of depending on whichever plan you sign up for. Okay, so those are some important ways that you can kind of monitor your costs and how these plans can, you know, start working for you based on what you select. Okay. Picking the right providers and facilities is also very important. As I mentioned, by seeing in-network providers, you maximize your benefits. Okay, some plans do allow coverage for non-network providers, but the out-of-pocket expenses are almost always more than seeing in-network providers. Also, where you go matters as well. Going to the emergency room for for conditions that are not emergent, that's one way, that's one way you can actually end up spending more than you need to, versus just waiting to see the doctor the next day, or seeing a doctor telephonically, or using an urgent care facility. So picking the right providers and facilities is also important in saving money. Okay, remember to use the emergency only for emergencies. Emergency visits, ER visits, tend to be very expensive, okay, versus your regular doctor visit. Choosing generic when available. Okay, so generic medications, if you are taking medications, generic medications contain the same active ingredients. They cost 3 to 4 times less than their brand name equivalents. But of course, whenever you're thinking about making any changes to your medications, you want to check with your doctor first to see if there's a generic available, and if it's appropriate for your condition. And then finally, another way you can save money is using mail order versus for your maintenance medication. So mail order is convenient. The medications are mailed directly to your home. You can receive a 3-month supply for the cost of a 2-month supply, which right there can save you some money. Contact CVS or Kaiser for more information on how to sign up. Okay, and our last slide here, our wellness programs. We're encouraging our members on all 4 of our HMSA plans, as well as our 2 Kaiser plans, to definitely get your annual physicals and screenings. I know that's not something very practical at the moment, but once life starts getting back to normal, it's always good to have your annual physicals and screening, because what these procedures can help with is early risk detection. And if you do have a condition, the earlier you can discover what that condition is and treat it, the better overall your health will be, and it will end up costing you less in the long run. Okay. If you're a smoker and you're thinking about quitting, both HMSA and Kaiser offer tobacco cessation products and programs to help you kick the habit. Disease management programs are also available through HMSA and Kaiser. So if you suffer from a chronic condition such as COPD, congestive heart failure, diabetes, these disease management programs can help you better manage your condition, can help educate and provide support for those who have chronic conditions. And then the last one here, health coaching. Both HMSA and Kaiser offer online and telephonic health coaching available if you're thinking about starting an exercise program or meal planning. So these are great ways. These programs, for the most part, are available to you under your HMSA and Kaiser plans at no cost. All right, so we really want to encourage you folks to take advantage of these wellness programs. Okay, so I understand that was a lot of information, but at this time, we'd like to open up the panel for questions.
Yes, and thank you so much, Kali. So you folks have been listening to Kali Pu'u'ohau from the EUTF. He's an outreach and training specialist, and we thank Kali for joining us today. He's going to take a bunch of there's been a whole bunch of questions, and we thank the folks who've been answering them as well. Kali, your colleague Emily Kaneakua, program specialist from EUTF, has been helping to answer those questions. So folks reading along in the chat, she does know what she's talking about, as you can tell, and she is an expert in this. She's been helping in the comments. We're going to ask you some of those questions, though, just so folks can hear them as well. We also thank HSTA's Vice President, Osa Tui, who is also answering a lot of questions in the comments. And we thank Kali's colleague, Marvin Judd, who is also helping us to answer some of those comments. We have open enrollment a couple more weeks this time, right? Usually open enrollment is only the month of April, Kali, and this, because of the coronavirus, it's been extended a couple more weeks to May 15th. So let's get to some of those questions. And our first one, well, this one came in a couple of different times. So what if I don't want to make any changes on my plan? Rich wanted to know, and so did MJ. Do I have to do anything if I'm not going to make any changes?
Do nothing. Don't turn anything in. Don't do anything. What you currently have now will automatically roll into the next plan year. So only send something in if you want to make changes. But if we don't receive anything, we're going to assume that you're happy with the plans you have, with the selections you have, with the people already on your plan. We're not going to touch anything. Everything just rolls into the next plan year as is. We do suggest that you check our website for the new premiums that are going to come out in July, just so you're aware. I don't think, generally speaking, they haven't gone up a whole lot at all. In fact, in some cases, some of the premiums may have gone down a bit. So no major fluctuations this year, but it's just a good idea to check. But aside from that, if you're happy with what you have, no action needed on your part.
Okay, thanks, Kali. The next question is, what form do I use? Keisha wants to know, what form does she use to change dependents? Is it EC1?
It's the EC1 form for most for teachers. If you started your employment on or after January 1st of 2011, it's definitely the EC1 form. But if you have the old HST VB plans and never switched over to EUTF, then any changes to your dependent, you would use the EC1H form.
Okay, great. Samantha wants to know, if I were to turn in forms for a qualifying event, is the coverage immediate, or does coverage start on July 1 as well?
It's a great question. So qualifying events, things like your effective date would actually depend on the qualifying event. So for example, in like for a birth, okay, so the effective date would be the birth of the child, so that we can pick up the hospital services. So open enrollment, that July 1st date is mainly for folks for that open enrollment event. But if you have a qualifying event like a marriage, a birth, or there was a loss of coverage, you're trying to get on the EUTF plans, that would vary depending on the type of event. In our reference guide towards the back, I don't know the exact page, but under enrollment and eligibility section, we actually have a chart that shows all the different qualifying events as well as when those plans take effect.
Okay. Jamie Lynn says that we are under my husband's plan right now through his work, but it does not cover everything. So is there an HMSA supplemental plan?
Jamie, great question. Is there an HMSA supplemental plan? We don't offer HMSA supplemental plans. There is a supplemental plan that is offered through the EUTF. It's under the HMA company. And that plan, you have to have another health insurance, which sounds like you do, right? That covers you, like another HMSA or Kaiser. And then the supplemental plan, basically how it works is your first plan would pay the doctor's visit or whatever the service is. And then you get the receipts, and then you file the receipts over to our HMA supplemental plan, and then they would reimburse you up to a certain dollar amount every year. There's more details that can be found in our reference guide, but we do have a supplemental plan, but it's not an HMSA one, and that's your question.
Okay, Kali, next question comes from Carrie. She says, I think what she's trying to say here is, can you make the effective date now with all that's going on, so those who don't have coverage can get it now?
Okay, interesting question. So if you don't have coverage, I'm assuming if it's for open enrollment, the effective date for open enrollment is something a little bit different. What you're describing is, are you a new hire? Is that why you don't have coverage now? I mean, if you're working, you should have, for the state or the county, you should have coverage unless you decline coverage. But for open enrollment, so folks that either already have coverage and want to make changes, that's something a little bit different. That's always July 1. If you have a qualifying event, then as I mentioned earlier, your effective date would depend on the type of qualifying event you have. Qualifying event is something that happens, some kind of life event that allows you to either come onto the plan or get off of the plan. Some qualifying events like you have a spouse that started working and their plan is better than what you have and you don't want to pay for EUTF anymore, that would be an example of that kind of qualifying event. So it's on or off. It varies on the event. It varies on the event, but open enrollment is if you have no coverage now and you want to get coverage, first, you may want to check to see if you have a qualifying event that can get you that coverage prior to July 1. Because if it's open enrollment, it's set at July 1. Hope that answers your question. Sorry.
Okay, great. And Carrie wants to know, what is the difference between HSTA VB versus EUTF coverage? You touched on it a little earlier.
Yeah, it's a great question. It represents coverage that was available back in early 2009, and there's a court case involved, and basically those folks that had the HSTA VB coverage, their coverage options are a bit different. They were given the choice to either keep the coverage they have or switch over to the EUTF. So that ability to keep or switch ended for teachers that started working for the DOE January 1st, 2011. So everyone that had that start date or afterwards, that HSTA VB option is not open to you folks. So most folks that have the HSTA VB, they know that they have the HSTA VB. It's slightly different coverages. It was coverage that was available back in 2009 for the most part. Their coverage options are a little different. They only have 2 HMSAs and 1 Kaiser, versus the EUTF plan options have 4 HMSAs and 2 Kaisers. So the options aren't as much, but there's pros and cons as far as whether they want to switch or stay, and it's mainly a matter of preference for the employee.
And next, Alicia wants to know if she can stop the plan at any time. Does she have to stay for the year?
Oh, it's a great question. Yeah, once you're locked on, so there's no volunteer terminations. So unless you have a qualifying event that'll allow you to get off the plan, as I kind of mentioned, yeah, you're normally on for that year, and then you can use open enrollment to get off the plan. And I'll just touch a bit more on that, on an example of when you can get off the plan. If you have, so the qualifying event is called acquired coverage. So if you acquire coverage, you or like a spouse or partner, you find coverage elsewhere and you're covered under that new plan, that's a qualifying event to get you off the EUTF plan. That would be fine. But outside of that, you'd have to wait to open enrollment.
And our next question comes from Patty, who says, if my health insurance premium is paid from my paycheck and my husband retires from the county of Hawaii, will his retirement health coverage, retirement health insurance coverage take over once he retires?
So the
take
husband
over for her.
Yeah,
he's going to retire. He's going to retire.
Yeah.
Her health insurance premiums are paid right now out of her DOE paycheck, right? So
got it.
He's trying to figure out what's going to happen once he retires. Does she have to, can she stop paying?
Oh yeah, well that's definitely an option. I mean, if your spouse is going to retire from the county, and it's normally a matter of because our retiree options are very similar to the options available for active employees. So most retirees, if depending on whether they have accumulated enough years, if for most folks financially it ends up costing less jumping on his retiree plan, I mean that's the route that they go with. Yeah, that's definitely an option. It's something that that when a time comes for him to retire, when you meet with us or when you fill out your forms, something that you decide, hey, we're gonna go ahead. We're just not gonna jump on the retiree plan or however that pans out. It's not something that's automatic though. It doesn't automatically, like we don't automatically stop your active plans, because there's some cases where they don't want to switch. They want to keep their active plan, right? So we leave it up to the individuals involved, the active employee and the retiree.
Okay, next, Keisha wants to know if she's adding or subtracting dependents right now. Is she going to be using the 1920 form or the 2021 form?
Definitely the 2021 form for open enrollment. And if the qualifying event will occur after July 1, you want the 2020 form. Anything prior to that, if there's a qualifying event that'll happen in May or June, then you want to use the older one. So the turnaround date is July 1. Anything on July 1 or afterwards, you want the 2020 form. Great question.
Okay, and Keith wants to know, I know you get these ones all the time. What is the better plan? The 80-20, the 80-20 EUTF, or the 90-10 EUTF?
80-20 EUTF, 90-10. To me, the what you want to do is you want to look at the premiums, the premium costs versus how often you're going to go and receive services, because between if you look at the HMSA PPO options, 90-10, 80-20, and 75-25, between the 90-10 and the 80-20, that's only a 10% difference. And between the 80-20 and the 75-25, that's a 5%. So the percentage, the co-insurance percentage wise, is not that much. It's not that much, 10%, 5%, but the premiums are very different. Okay, in some cases, if you do it like an example, we got the monthly cost and we multiplied the monthly premiums and multiplied it by 12. Okay, then you can kind of see how much you're paying through in any given year. Okay, so of course we can't tell you what plan to sign up for, but that would be the way to do it, though. Look at the benefits, but then everyone looks at the benefits. Not a whole lot of folks pay attention to the monthly costs. That's the one you want to look at. How much is coming out of your check in a 12-month period, and are you comfortable with that? Based on it's great to have great insurance, but a lot of folks are overinsured. You're paying thousands of dollars for this insurance, and you don't even go to the doctor, or you go like once a year, for something really expensive. You may want to look at downgrading to 80-20 or 75-25 on the HMSA end, and then have some of that money go back into your paycheck. Right? Everyone will be different, so something to definitely consider.
All right, Jonathan wants to know if he's getting married in September.
Congratulations, Jonathan.
Should I add my significant other to the two-party plan now, or wait until September is when they're getting married?
Oh, great question. You have to be married before you can add your spouse. So how that would work is, if it's a September 20th, you would complete the EC1 form, and you will have 45 days to submit to our office the EC1 to add your spouse, and then your spouse will be added on effective the marriage date. So that would be a qualifying event.
Great. And people enjoyed the examples you were giving us, the hypotheticals with Malia and all these different people. They wanted to know about where these examples are on the website. Obviously, this live presentation is archived both on HSTA's Facebook page and on our YouTube channel. So folks can go back, once it's POW, they can go back and kind of search through it and look at Kali's presentation to, freeze frame and really study stuff. But Kali, is it also available on the EUTF website so they can kind of take a look at this on their own?
Yes, it's available on the EUTF website under the active tab. Actually, it's currently on our homepage on those sliders. One of the sliders is labeled open enrollment, and then just scroll down for the on-demand video. So it's exact same presentation. You can watch at any time. You just click play in and watch it as a video.
And that's good, right?
Slide decks are available also.
Yeah, and they can share it with their loved ones as they're kind of analyzing.
Yeah.
Great. A few more questions here before we wrap up. There's lots of different interesting issues. Patty wants to know, do we need a full-time college student letter every year for her dependent college-age child?
Oh, yeah. That's a great question. Yes, but we normally send out the notice to the employee, letting them know when we need the letter by. Yes, we do need to substantiate their full-time enrollment in some kind of college or school. Yes.
Okay.
And you'll get a letter from us, normally around somewhere near the child's birth date.
Okay. Kelly wants to know, is there somewhere online I can go to play out some scenarios? You know, the one you were going through some, but is there somewhere where people can enter some scenarios to see what plan is better for her and her family? Or can I call to speak to someone? She's planning to give birth in July, so she'd like the most cost-effective plan.
Oh, wow. We have not set up something like that as of yet. It's a great idea, though. Thank you for the suggestion. We can play
And
out different scenarios. Yeah.
could she contact HMSA or Kaiser directly for those kind of details?
Oh yeah. So details on definitely, that's a great idea. Details on a plan, especially things like maternity, because of course they're familiar with our plan options. We also have notice of coverage documents on our website under the active tab that do deep dives into the benefits for the 90-10, the 80-20, 75-25, the HMSA, HMO, as well as the two Kaiser comprehensive and the Kaiser standard. And they all have, they're kind of big booklets, and they all have sections on maternity. And then you can, if you want to do a deep dive that way, but nothing, no cross comparisons though. Yeah, but we do have the information, or as mentioned, you can definitely contact the carriers directly as well.
Okay, and Lori wants to know, do dependent minors need to be full-time students to be covered for medical only?
Great question. So for medical and prescription drug, they're covered to age 26, no prerequisites. It doesn't matter whether they're going to school, not going to school, married, not married, living with you, not living with you. And that was a change made back in 2010 with the Affordable Care Act under Obamacare. So, but that same federal act did not apply to dental and vision. So that's why the letters and the stipulations are there, but only for the dental and vision, not the medical and prescription drug.
Okay. Another person Fern wanted to know, is there going to be another live information presentation? This is our only one this month, but the nice thing is these are going to be archived, right? So anybody can watch this at any time. Once it's POW, it's available on our YouTube channel, Hawaii State Teachers Association YouTube channel, and on our HSTA Facebook page for you folks to review or to send around to your loved ones or your friends to get them to watch it. So thank you for asking that question. And
also, we have webinars throughout the month of April that you can jump on.
Great. And
literally the whole month.
And the schedule is available, right, on the EUTF website, so folks can jump on.
Yeah, we have them tomorrow. Yep.
Great. And yeah, you already did 2 today. It was before ours, right?
Yeah.
Anna says, I'm a teacher. I want to make changes. Can I do all of that online?
You would need to submit but you would need to print the form out and submit it to the EBU office.
Okay. We have another question came in from one of our viewers on YouTube. If I'm not hired back when school starts, how will that impact my insurance, and what things do I need to do to have insurance? Would Cobra kick in at that point if I'm not hired back in the fall?
Yes. If worst case, if that does happen and you're not hired back, you do have Cobra. We will send out Cobra continuation of coverage information. For both for your plan options that you've elected. Keep in mind a couple of things with Cobra. One, is very expensive. Cobra is expensive. 2, you don't have to. So if you selected medical, prescription drug, dental, and vision under Cobra, you don't need all 5. You can just, if cost wise, it'd just be better for you to get the medical package, and it is a package. You can't separate it. The medical and prescription drug and the chiropractic is all under one. You can just, if it saves you money, you can just take away the dental and vision and just go with that. But definitely Cobra will be sent to you. But because of the cost, we also recommend you check into the connectors or other means to pick up health insurance. But Cobra is definitely an option for you.
Okay. For comparison, do you know, Fern wants to know if there was a deductible for the 75-25 last year. Has it changed from last year to this year, the deductible for the 75-25? That's the $300. Yeah, okay. It's a $300 deductible.
Has the 75-25 plan deductible changed? No, it's the same.
Still $300.
Yeah.
Okay, good to know. Okay, Amaile wants to know, do we send in copies of birth certificates or originals for dependents?
Please send in copies.
Not the original. Okay,
No, we don't need the original.
okay, that's great. Another Stacy asks, I only have a basic life insurance plan that's fully covered with no out-of-pocket expenses under the HSTA VIBA trust, but no medical at this time. Am I still eligible to re-enroll for medical under the HSTA VB plan under that form?
You have.
Is she still eligible to re-enroll for medical under the HSTA VB plan, the EC1H form?
You may want to check with our office. You may want to check with our office to see if you're eligible. It's a great question.
Okay. And speaking about checking with your office, Chris, could we put up the full screen of various ways to check in with EUTF? Chris, if you don't mind putting that full screen up, we would really, that's probably helpful for people. Okay, great.
Awesome.
Sorry, there's a delay on our site. There it is. So many ways to contact EUTF. The web page, the contact page with a form, so you can ask a specific question, right, Cully? And what else?
Yep.
What else do you want them to know about that contact page?
As you folks probably guess, we have no more walk-in. So everything is done via telephone and any kind of correspondence. Like if you're going to plan on retiring soon, it has to be done via mail. So we no longer take in any correspondence as far as walk-ins or couriers.
Okay, and so the mail obviously takes a couple more days, and that's nice because they have added 2 more weeks to open enrollment this year. So instead of just the month of April, it is lasting through May 15th this year.
Yes.
So it's really, instead of a month, it's a month and a half.
Yeah.
Okay. A couple more questions, and we're going to wrap up.
Okay.
Lori is asking, if I retire, do my dependents have medical to age 26, just like active employee? You know, just as if she was continuing to be an active employee.
Oh wow, good question, Laurie. Answer is no. Again, the federal law that extended the limiting age for dependents to age 26 for medical and prescription drug only applied to group-sponsored plans. It didn't apply to retiree plans. So for retirees, and that's important to remember, if you're planning on retiring and you have dependents around that age, the act of retiring might kick your dependents off the plan because of the age differences. So for retirees, dependents can stay on retire. If you cover your dependents, you may do so as a retiree up to age 19 for medical, prescription drug, dental, and vision. But if they're unmarried full-time students, they can stay to age 24. That's the difference. Great question.
And Momo wants to know, how do I change the name on my insurance? She has already changed the name payroll, DOE payroll, but what she wants to change the name on insurance now.
Name changes. I think that's done via. She can submit an EC1 form to her personnel to the EBU office for the name change.
With proof documents, is that right? I'm just cheating here because that's what Marvin wrote, so I sound like I'm really smart.
Thank you, Marv. Marv's an expert on that.
So the proof documents would be what? What does that mean?
Marriage certificate or some kind of a.
Got it. Okay, that sounds great. Okay, I'm just trying to see if there's any other last-minute questions here. Thank you so much. We had more than 100 people watching us at one point, and we know that many hundreds more will watch the replay. From YouTube. Why doesn't HSTA VB have supplemental coverage? If I switch to supplemental and EUTF gets rid of it, can I go back to VB coverage?
Okay. Yeah. Normally, if and that's the thing with the whole HSTA VB and EUTF plan options, right? So normally, if you switch from one to the other, well, it's normally a one-way trip. So if you go from HSTA VB plan options, you switch to EUTF, Okay, in most cases, you cannot go back. You will have EUTF coverage moving forward. So that's something to remember, to keep in mind rather.
Okay, and Liz is asking on YouTube, please explain connectors. What is that, and could you refer me to who to call for more information?
Oh wow, okay. Darn, I don't have my
Capital
phone.
C connectors. I don't know what that is either.
I don't have my phone. Connectors was a program that was offered under Obamacare. It was health insurance. Sorry, I never have it on my phone, but I don't have my phone at the moment. Locally, it was health insurance available through the federal government, and if you had if you had a certain income, you could qualify for tax breaks. It's kind of not offered, not too popular, but I don't think it's completely out. If you maybe Google healthconnectors.gov, the information should pop up.
Okay. Okay.
Okay.
We understand it's gone completely, right? Is this because of?
Oh, it might have been. Yeah, it might have been.
This is the old Obamacare that's some of this is being phased out, right? The old health connectors. Okay.
Yeah.
I think that's been phased out as far as we know. Our sources in the insurance company are talking into my ear and telling me that. So. Okay, great. Well, thank you so much.
That's info to me, so thank you.
Thank you so much, Kali, for joining us, and to HSTA members for joining us. And again,
thank you, HSTA, for allowing us to participate.
Yeah, thank you for all the good questions. We hope we answered them, and please encourage your friends and family, if they haven't seen this presentation, to take a look at it, listen to it, read all the comments. Thank you so much to Emily Kaneakua and to Marvin Judd, too, who are helping answer questions, and also Tui, our HSTA Vice President. Lots of substantive answers with lots of links in the questions, and our communications specialist, Terry Inafuku, was also answering with links to our web story, links to also Tui's awesome chart that shows you the dollar difference between plans this year versus next year on all those plans, so you can do your own cool comparisons. It's a color chart that's very, very popular. It's the first link in our web story. Lots of people use that to take a look at how things will change. Thanks again, Kali. Thanks to all for joining us, and have a good evening.
Stay safe, everyone.